Pain shooting down your leg, numbness in your foot, a deep ache that won't quit. If you've experienced any of these, you need to know. Is this low back pain or is it sciatica? Without a proper diagnosis, you can spend months, sometimes years, not getting better. I'm Dr. Robert Moss, physical therapist with 28 years of orthopedic experience. I've evaluated and treated thousands of patients dealing with exactly the same thing you have. And today I'm going to give you a clear clinical breakdown so you can understand what's happening in your body. So what is low back pain? Usually it's localized to the lumbar region, the low back area. Typically involves muscles, joints, or disc without nerve involvement. Pain is usually dull, achy, or sharp, and typically does not travel below the buttocks. Low back pain is incredibly common. About 80% of adults will experience it at some point, but common doesn't mean it should be dismissed. Then what is sciatica? Sciatica is a compression or an irritation of the sciatic nerve, which is made up of the L4 to the S1 nerve roots, hence the sciatic nerve. And it travels through the buttocks, down the back of the leg, and into the foot. Symptoms can include radiating pain, burning, numbness, tingling, or weakness that travels below the knee, often into the calf, heel, or foot. The classic test is if your pain stays above the hip, it's more likely back pain. If it goes below the hip and buttocks, especially with neurological symptoms, we're talking about nerve involvement. Now, most common causes: disc herniation, compressing a nerve root, but also it could be piriformis syndrome, spinal stenosis, degenerative disc disease with foraminal narrowing. The diagnostic clues include low back pain is typically in the hip and the lower back. It's dull and achy or sometimes sharp with local pain. It can be worse with bending forward, lifting, sitting, and early in the morning. Better with rest or position changes. Sciatica, the pain travels to the leg, often below the knee. It can include burning, tingling, numbness, and weakness. Worse with standing, walking, or bending forward, and usually better with laying down. Now, no YouTube video replaces a proper clinical evaluation, but this gives you the language to describe your symptoms accurately to your provider. Treatment differs significantly. So core stability exercises for mechanical back pain, they can actually irritate the nerve if programmed incorrectly. Now, nerve flossing, nerve gliding, and specific positional loading strategies are needed for sciatic presentations to help open up the foramen and give the nerve some relief. This is why I spend a full hour on the initial evaluation. Rushing to treatment without an accurate diagnosis is how people end up worse. Now, when to see a provider urgently? Okay, these are red flags: progressive leg weakness, foot drop, bowel or bladder changes. See a provider immediately. Go to the ER. These indicate potential cauda equina involvement and require urgent medical evaluation. I'd rather have 100 patients come see me when they don't need urgent care than miss one who does. Now you know the difference, and more importantly, you know why it matters for your recovery. In next week's video, I'm going to cover the 5 worst things you might be doing right now for your back pain. Trust me, this one's going to hit home for most of you. So subscribe so you don't miss it. Like this video if it helped you, and leave a comment below. Tell me, which do you think you're dealing with, low back pain or sciatica? Until the next one, move well, live well.